Eh? Iko sawa. Umesema nataka kuongelea. Unasema ongelea hapo. Sasa bosa mnasisi. Hapo is it okay there? Sawa. Then where is the podium? Where is the PS? Podium ndio podium.
Where is he? Where is Linda? Hapa.
Biki.
Paulo, how are you?
So, Your Excellency, thank you. So, Your Excellency, thank you very much for having gathered us here today. And in the interest of time, I'll just spend 1 minute to introduce the team that is here. We have the AMREF group led by Dr. Gidinji. And basically what AMREF has done is to coordinate this whole exercise, Your Excellency, on behalf of the ministry in the procurement and distribution of the oxygen cylinders to all the counties. We also have the funder, Mr. Morrison, from Global Fund, who has just arrived. Your Excellency, there was a small delay at the airport, but he has just arrived and is with us. He will speak to what he has been able to do, and he has already apologized. And also, Your Excellency, Ministry of Health officials are here, led by our capable Cabinet Secretary, and who will invite you to speak. But for now, let me just call Dr. Gidinji, the CEO AMREF, just to come and speak to the whole ecosystem of oxygen, so that we can invite Mr. Morrison also to give a brief.
Asante. Yeah, I think you're speaking to my future, Your Excellency. Yeah, thank you very much. Excellency, distinguished colleagues, it gives me great pleasure to be here today to talk on this issue that touches all universal health coverage. And I'm really touched by how eloquently, Your Excellency, you discussed the issue of universal health coverage and primary health care for this country, for now and the future. Let me just very quickly introduce AMREF Health Africa as a partner of the Global Fund. AMREF Health Africa, Your Excellency, is actually globally headquartered in Kenya and hosted by your government through a host country agreement. I myself am the first Kenyan to actually lead AMREF in 2015. So we are very proud that AMREF Health Africa, a global NGO headquartered in Kenya, is actually led and headquartered here. And we spend significantly across the areas of HIV, TB, malaria, primary health care, community health, promoters now, and community health workers. And we spend over 10 billion Kenya shillings in the health sector, including the AMREF University, the work we do in the programs, in the Kenya Country Program, and also AMREF Flying Doctors. We are partners of the Global Fund for HIV, TB, malaria. Time, and we work very closely, not only in Kenya, but in Tanzania and also in other countries. So as an organization internationally hosted in Kenya by your government, you are then by nature our patron. So we are here on your behalf. Thank you very much. We wish to thank the Ministry of Health at the national government. We also wish to thank the county governments for a very harmonious working relationship with this organization since 1957. This is more than 65 years of AMREF working in this country. And today, with the multilateral support of the Global Fund, and I'm glad my friend and brother Lyndon Morrison is here. Thank you very much. He was, Your Excellency, I must say that he had a small challenge, and because of the AMRE flying doctors, because we have a set of aircraft that we use for charity evacuation, for transport, we were able to actually go to Mombasa and evacuate Mr. Morrison and bring him here. So we're glad we could offer that support to get him here in good time. The project we are discussing today, Excellency, is a launch of oxygen infrastructure. Of course, today we are going to launch visually about 20,600 oxygen cylinders. We have not filled them with oxygen because that depends on consumption. Yes, depends on consumption, but we have 150 here that are already filled with oxygen. These cylinders, Your Excellency, are marked Government of Kenya, Ministry of Health. Because, as Lyndon will say, the Global Fund is not a donor. It's actually a partner of government because it's a multilateral mechanism whose money is owned by governments, including the government of Kenya. And we are really grateful that they responded to the COVID-19 challenge of access to oxygen. We went through the government and Ministry of Health to the counties to assess the challenges of oxygen access, which were highlighted, as you said earlier, by the demand through COVID-19. And out of that, the mapping was done, and it was a dire situation. Many of the challenges we found, Your Excellency, were that oxygen was not available, that even where we had the production plants for oxygen, many of them were not properly maintained. But one of the critical challenges was oxygen cylinders. Oxygen cylinders became a problem because they were not available. At some point, we thought we had about 20,000, but they were disappearing in people's homes because of the demand and the need for people. We then found that actually, and the governors are here, and I'm really happy they're here, that for every hospital or governor to access oxygen, you have to put a deposit for an oxygen cylinder so that you can access that oxygen cylinder to be filled for oxygen for your patients. This, deposit was significant. In some areas, it was 4,000 shillings. In some areas, it was 17,000 shillings. And this project we are launching today, Excellency, removes the need and the demand for deposits from the governors to access oxygen. That is significant because now the oxygen can be accessed as and when needed. And that is why, with the support of the Global Fund for HIV/TB malaria, we are launching today, and they are available in this country, 20,620 medical oxygen cylinders worth 1 billion shillings from the Global Fund. But these cylinders are just a visual representation of your honored launch of this project today, Your Excellency. This project is part of a 5 billion Kenya shilling project for $1 million through the support of the Global Fund special mechanism. The Global Fund supports HIV/TB malaria, but we have been working with the Global Fund to ensure that the Global Fund also supports health system strengthening for countries not only to be dependent on the Global Fund, but also to build the health systems for primary health care and for universal health coverage. And during COVID-19, the Global Fund responded and said they are indeed going to repurpose some of the funds to support the oxygen infrastructure. So as part of these 5 billion, 1 billion is going to cylinders, but the rest of it is going to the construction of 22 oxygen production plants across the country, Your Excellency, supply and installation of 14 oxygen bulk tanks. These are bulk tanks that allow level 4, level 5 hospitals to have oxygen just right there, which is piped into the hospital, that they don't have to rely on cylinders. But beyond that, we've had a challenge. We found out that cylinders in this country and in many countries in Africa are used one cylinder, one patient, which means that whereas one cylinder can serve multiple patients, you have cylinders dedicated to a bed. This problem is being solved in this project, Your Excellency, by doing what we call manifolds to ensure multiple cylinders can be attached together and supply the oxygen to a hospital through a piping system, which means now that you can actually optimize the existing cylinders. That's also part of this project. This project is these manifolds and tanks are going to reach 320 primary healthcare facilities. They are also going to get monitors for patients. But beyond that, these cylinders that we are launching today, Your Excellency, will reach more than thousands of facilities as the governors and the counties and the sub-county health teams deploy the oxygen. So I would like to proudly call this project, Your Excellency, with your permission, Hewa Mashinani. Hewa Mashinani. So this marks a major milestone, and this Hewa Mashinani project means no more cylinders. As I come to a conclusion, Your Excellency, I would like to say generally that AMREF Health Africa is a partner of government in delivery of primary health care and universal health coverage. One of the challenges I would like to bring to your attention and highlight, and of course you are aware, is that we will continue to work together with partners like Global Fund and others to reduce the burden of infectious diseases. But at the same time, we need to start paying attention to emerging non-communicable diseases, cancer, hypertension, diabetes, that are going to be a challenge to this, to our health system, and also diseases that are going to arise from the emerging climate change, on which you have shown excellent leadership across the continent. And we are happy that you'll be hosting the Africa Climate Action Summit in September in Kenya, and we commit to bring the health agenda to that summit that you're hosting, Your Excellency, ahead of the COP28, which has now formally agreed to have a health day to ensure that adaptation of the health systems to climate change is part of the climate change agenda. So, ladies and gentlemen, as I close, is to say thank you very much. Our universal health coverage journey is on plan with our partners. I don't know how many of us know here that for countries that claim to have achieved universal health coverage, largely in Europe, they spend $4,000 per person per year, all public money. In Kenya and in many countries in Africa, not many, actually all of them, we are lucky to achieve $50 per person per year of government money, combined between central and national government. So literally, Your Excellency, we are solving a $4,000 problem with $50, which means that for us in Kenya, efficiency, excellence, innovation is critical to achievement of universal health coverage, because we literally do not have money to throw at the health problem. Your Excellency, thank you very much. I wish to thank you, your government, the county government, the Global Fund. Thank you very much. Please, deliver our thanks to the Global Health Headquarters and to the CEO, Peter Sands. Our partners are, of course, the county government that we've worked with very closely, and of course the team at the MOH that has worked with us, and the team at AMREF that's represented here by the country director from Kenya and Bernard Langat, who has been handling this project. Thank you for your attention. For God and the country. God bless Kenya. God bless you all. Thank you very much.
Thank you very much, Your Excellency. Thank you, Dr. Gitai, for that elaborate explanation. That the person who pays the piper, God. And I have heard Dr. Gidinji alluding to the people that this time, Your Excellency, to call upon Mr. Lyndon Morrison, just to come and tell us how he did it.
Good morning, all. Your Excellency, President Ruto, distinguished guests, governors, ladies and gentlemen, all protocol observed. On behalf of the Global Fund, I want to extend my gratitude to the people of Kenya, led by Your Excellency, President Ruto, for offering much leadership in addressing the health needs. We thank all members of our partnerships, and I want to stress our partnerships, including government agencies, donor government, civil society, and community partners for helping to engage to change the trajectory of health in Kenya. Not only change the trajectory of health in Kenya, but also change the trajectory in the fight against HIV, TB, malaria, and building health systems. The Global Fund, as you're aware, as was pointed out, is an international organization that is committed to fighting the world's deadliest diseases confronting humanity, including HIV, tuberculosis, malaria, and also building health systems. Over the past 20 years, our unique partnership has invested more than $55 billion worldwide, saving 50 million lives, and reducing the combined death rate from HIV, TB, malaria by more than half in the countries we address. In Kenya alone, to date, we've invested just short of $2 billion. And more recently, as you will hear later in my speech, we have an additional $400 million. We are extremely grateful for the generosity of our donors in the seventh replenishment, which is last year, which raised $15.7 billion. Here, we were particularly grateful for the strong partnership we enjoy with Kenya. Your Excellency, Kenya is one of the most committed donors for the Global Fund. Not only are a great implementer, but I must point out, Kenya is a committed donor to the Global Fund. Our motto for the last sixth replenishment was no one left behind. Step up to the fight. Kenya, I want you to hear this carefully, Kenya increased its pledge from $6 million to $10 million. One of the largest increase by any donor. Those funds are going to enable us to invest more in the fight against the 3 diseases and building resilient health systems for health in Kenya and beyond. Not only in Kenya, but Kenya, I must point out, also plays a critical role in the Global Fund Board in shaping health policies. More recently, as an example, your fight against COVID, what you've done, what we learned from Kenya, really helped to shape the Global Fund investments in COVID. So I must congratulate you. Global Fund has been a long-standing part of Kenya in the fight against HIV, TB, malaria, and building health system. And more recently, I was pointed out by my colleague in fighting the COVID pandemic. In fighting these diseases, we've also invested strongly in building health and community systems. Just to name a few, KEMSA, of course, working closely with AMREF, who's now a global leader, etc., etc. Recently, the Global Fund allotted an additional $407 million. That's on top of the $1.7 billion I mentioned, $1.9 billion mentioned, for what we call Grant Cycle 7. These funds will be invested starting next year. The COVID pandemic has highlighted the importance of global collaboration in responding to health crisis. Through the Global Fund COVID-19 response, Kenya has been allocated $155 million in emergency funding to support the country's response to pandemic and build resilient health systems. This funding has supported the procurement of essential medicines, as was pointed out today, also building the health oxygen infrastructure and diagnostics. We've also supported training for healthcare workers and community and health volunteers to ensure that they have the necessary skills and knowledge to respond. We at the Global Fund cannot achieve this without your strong support. Through the Emergency Fund, Kenya is strengthening the medical oxygen ecosystem, including the procurement of the 20,000 bulk cylinders mentioned today. Thank you, Your Excellency, for flagging off the distribution of these 20,000 cylinders. That will benefit all the counties, for some counties in Kenya, as a contribution to strengthening the primary healthcare system. I want to go back to when we mentioned the partnership. When we mentioned the partnership, the Global Fund, as I mentioned, a robust partnership. We raise the money, you spend the money and prove it. What we've observed, Kenya is one of the countries that we could point to as a model partnership. Here today, with the donors funding, strong commitment from the government, work from an NGO, today we are actually, this combined partnership is demonstrated clearly in what we're celebrating here today. So I want to give yourselves a round of applause for that. The Global Fund remains committed to supporting Kenya to build resilient and sustainable health system to combat HIV, TB, malaria while preparing for the country's future pandemics. This is a critical area. One of the challenges we face is that you remember the onset of COVID-19, the world is shut down. Now COVID-19, as the COVID-19 abates, we need to maintain that momentum to fight the future pandemics. Your Excellency, distinguished guests, ladies and gentlemen, the Global Fund, I turn to now the Global Fund. The Global Fund is now implementing our 2023 to 2028 strategy, which is focusing on fighting pandemics and building a healthier and more equitable world. We look to Kenya's leadership in this fight. We are committed to putting community at the center of our response, as I alluded earlier, which is premised on our renewed commitment to leave no one behind. Through this commitment, we will sustain our support to the government and people of Kenya towards addressing inequalities in access to quality health care for people living or affected with HIV, TB, malaria. We will continue to invest in accelerated innovation, as I pointed out, while encouraging and supporting increased local production of health products and services. We all learned from COVID that community services are essential for reaching the most marginalized population, expanding the reach and uptake of services beyond formal health facilities, and promoting and protecting the rights of all people. I want to point out here, just to stress the point I made earlier on, at the start of the pandemic, when the whole world was shut down, the Global Fund worked very closely with the government of Kenya and AMREF and really shaped the global response. In shaping this response, and because of the quick uptake of countries like Kenya, the leadership, we were able to raise over $4.4 billion to fight the pandemic. Thank you for that. Your Excellency, Mr. President, the Global Fund and stakeholders invite you, as was pointed out by my friend, my colleague, Itenji, to be the African champion for strengthening community health workforce in Africa. With your passion, your leadership, will elevate the central role of community health workers in helping accelerate the achievement of health and well-being for all. Friends, we have proven that with science, strong political commitment, adequate resources, and effective collaboration, we can force even the deadliest disease into retreat. Achieving this requires vision, sustained political leadership, substantial resources, and diverse partnership across the globe, including communities most affected by the three diseases. It can be done. Kenya demonstrated it can be done. The success over the last 20 years of the Global Fund has demonstrated that. In conclusion, again, I would like to express my sincere gratitude to the government and people of Kenya for its strong leadership, commitment to health and well-being of our citizens. I would also like to thank the donors, including Kenya, for your generous support, which has allowed us to support Kenya and other countries make strides towards ending HIV, TB, malaria, and building resilient health systems. Finally, I would like to take a moment and step back and say a special thank you to the frontline health workers, those community health workers who were at the forefront battling the COVID pandemic and who will today benefit from these resources. Once again, on behalf of the Global Fund, we value the Kenya partnership, and we are very happy to be invited today. We appreciate it. Thank you very much. Bye.
Thank you very much, President Morrison. Another round of applause. Thank you. Thank you, Your Excellency. Now we have the recipient with us, the county government. And allow me to call upon the chair, none other than the chair of the Council of Governors, just to speak to what we are doing.
Your Excellency, President of the Republic of Kenya and Commander-in-Chief of the Defense Forces, my colleague, Excellency Governors, Cabinet Secretary, Ministry of Health, Ms. Susanna Kumicha, Mr. Lee Den Morrison, representing the Global Fund, Dr. Gitahi, Regional Director, AMREF, representatives of national and county governments, development partners, private sector representatives, ladies and gentlemen. I would like to begin by thanking His Excellency the President for fostering a good relationship between the national and county governments. The collaboration between the two levels of government is critical in achieving Vision 2030 and by extension ensuring every Kenyan citizen has access to the highest attainable health standards. Since the onset of devolution, county governments have invested significant resources in strengthening health services and achieved good outcomes across all health system pillars. We have stepped up health facility infrastructure and equipment, increased focus on healthcare workforce, and increased budgets allocated at county level to health services. Today, we have a keen focus on primary healthcare and community health services. This launch, Your Excellencies, ladies and gentlemen, goes a long way in improving the capacity of our health system across all 47 counties. As such, the Council of Governors is glad to be part of this flagging off. The universal health coverage agenda is the hallmark of the Kenya Kwanza government's commitment to improve the well-being of Kenyans by ensuring that people have access to the health care they need without suffering financial hardship. Achievement of UHC is not just a health sector matter, but one that requires multi-sectoral action, especially in addressing the social determinants of health, like education, physical and social environment, and the wider set of forces affecting people's health and their access to health services. To attain UHC, both levels of government as well as other actors like the private sector must work together in strengthening health service delivery. Your Excellency, ladies and gentlemen, there is a commitment by the Kenya Kwanza administration to accelerate implementation of strategic interventions to address access and affordability barriers to healthcare across county governments. Our first point of call is a paradigm shift by all of us from looking at healthcare as an expenditure to viewing it as a core development input. Investment in healthcare, therefore, is a constitutional responsibility as our citizens have a right to health. It is against this backdrop and the COVID-19 context that Global Fund, through AMREF, as a principal recipient, allocated additional funding to strengthen the medical oxygen ecosystem in Kenya. We thank the Global Fund and AMREF for these efforts. I would like to note that efficient and reliable supply chains are essential to a resilient health system and central to achieving universal health coverage. Reliable supply financing, as well as evidence-informed supply forecasting and procurement processes, are critical in ensuring sufficient and timely supplies. In Kenya, the procurement and financing of health commodities is shared between the Ministry of Health, county governments, and development partners. The Ministry of Health and Development Partners finance the procurement of commodities for vertical programs such as HIV, malaria, TB, family planning, while counties procure all other commodities. At this point, I would like to thank AMREF for building a robust supply chain system that has been used to deliver the oxygen ecosystem by the Global Fund. A robust oxygen ecosystem is paramount to not only improving healthcare in Kenya, but also cushioning the country against catastrophic incidences when public health threats strike. Your Excellencies, ladies and gentlemen, despite these notable milestones, there are issues that persistently stifle the progress counties are making in health service delivery. Amongst them are changing disease patterns, health worker strikes, inadequate staff, especially in specialty and critical care areas, inadequate funding, delayed disbursement of equitable share and conditional grants by National Treasury, and now the raging of pandemics. The oxygen ecosystem grants supported by Global Fund address various health system gaps, which is a step in the right direction. We therefore have drawn lessons from the implementation of this grant, which include the need to improve coordination in the planning, design and implementation of the project. There is also urgent need for formulation of norms and standards for infrastructure and equipment, as well as strengthening procurement and project implementation processes for effectiveness, efficiency, and overall value for money. By addressing these areas, far much more reaching success will be celebrated. Ladies and gentlemen, we know that Kenya is currently in the process of developing the next phase of Global Fund grant. As county governments, we would like to once again propose that the grant have a mechanism where National Treasury sub-grants implementation funding to county governments. This is a request we have put on the table before the Global Fund, the Ministry of Health, and the Treasury to consider, but has not yet been honored in previous grants. Direct grant funding to county governments will go a long way in enhancing service delivery and building sustainability, especially at this point in time when donor funding is reducing. Finally, ladies and gentlemen, Your Excellency, allow me to confirm that county governments are ready to receive these oxygen cylinders and remain fully committed to providing the highest quality of health services. I thank you all. Thank you.
Excellency, at this particular juncture, just allow me to welcome our able Cabinet Secretary to invite you on stage.
Thank you, Your Excellency. Thank you very much for accepting to flag off the cylinders today. Your Excellency, pre-COVID, our public health infrastructure for oxygen was suboptimal. And Your Excellency, COVID exposed our nakedness in terms of oxygen infrastructure. And I really want to thank Global Fund very sincerely through their implementing partner AMREF that has today given us the total ecosystem. And I want to thank AMREF for thinking this through, that you are not just giving us cylinders, but you have thought about the end-to-end need in terms of oxygen, that we are going to have the plants, the oxygen plants, that we are going to have the oxygen tanks, and finally to have the cylinders. So I really want to thank you, AMREF, for that. Your Excellency, we are now in the phase of implementing our universal health coverage that we promised in our manifesto. And I want to thank you, Your Excellency, for the guidance that you have given us so far. And we are now in the assessment stage, where we are assessing the infrastructure of health throughout the country. And I want to thank Global Fund again, because now when we go to do our assessment for the infrastructure for oxygen, we are going to tick that box, because today we have seen the cylinders. Your Excellency, I want to thank you very much, and I want to assure you that we are on course in implementing our universal health coverage through the pillars that we have identified. And we are in discussion with the Council of Governors, and we have agreed that moving forward, this process shall be consultative, and we are going to reach out to them so that we ensure that in implementing this, it does not fail the third time. It is now my humble duty to invite you, Your Excellency the President, to come and flag off the 20,620 oxygen cylinders. Thank you very much, and welcome, Your Excellency.
Thank you very much, Minister, and I want to take this opportunity to welcome my colleagues, governors from our counties. Karibuni sana. Thank you for responding to our invitation, together with the Global Fund and AMREF, our partners, who, because of their effort and the partnership that exists between the Government of Kenya and these global players, we have this function today, a very important function. Let me recognize the Chair of the Council of Governors, the Chair of the Health Committee of the Council of Governors, Mr. Lyndon Morrison, our good friend from the Global Fund, Dr. Githinji Kitahi, again, thank you for your wonderful speech. The Kenya Coordinating Mechanism members, governors who are present here, distinguished ladies and gentlemen. This afternoon, we are engaged in a very important event that is of utmost importance and significance for a number of critical reasons. The most important is, of course, the fact that every intervention in the provision of health care to the people of Kenya is of fundamental importance to the government and the people of Kenya. Our commitment goes beyond the traditional delivery of health services as a public good. The provision of universal health comes out of the recognition of the singular opportunity to intervene radically and make healthcare inclusive, accessible, affordable, and of very good standard. A healthy nation is a foundational constitutional expectation, and the right to the highest attainable standards of health is an entitlement of every citizen. Further, low access and inadequate access to health care facilities due to inadequate infrastructure and high costs has subjected many people to great suffering. Frequent illness deprives many people of the ability to fully pursue the opportunities of life, including education and gainful employment, and even leads to loss of life in some cases. Medical expenditure is also a notorious driver of poverty, robbing countless households of incomes and savings. Our universal health care commitment is therefore an integral component of the bottom-up transformation agenda. This agenda is radical because it commits to deliver bold and ambitious undertakings in the face of economic and geopolitical challenges in the context of the post-pandemic recovery. Consequently, it has become imperative to augment traditional governance with innovation and a strong measure of imagination for service delivery to meet the needs of a new but also a difficult moment. To achieve our transformational ambitions under the constraints of limited resources, we have opened up funding mechanisms and delivery frameworks to accommodate the participation of various partners, including private investors, development partners, multilateral agencies, and non-profit organizations, as well as civil society. The involvement, for example, of the Global Fund and our friends in AMREF in this case is an example. At the moment, significant programs and projects under our plan have been undertaken under the public-private partnership framework. Our affordable housing pillar, for example, is primarily going to be delivered using the PPP model. We also have bilateral partnership agreements to execute several important programs and projects in conjunction with friendly multilateral partners and governments. In addition, multilateral partners and multilateral organizations and development institutions have come on board to undertake critical projects in many sectors throughout the country. You heard the representative of Global Fund mention that we deliberately decided to increase our contribution to the Global Fund from $6 million every 3 years to $10 million because we want to create the partnership with other development partners and multilateral organizations to be able to support the delivery of our commitments as a government. I cannot sufficiently emphasize the magnitude of positive change we have achieved, the opportunities we have identified, and the potential to do much more and much better than earlier projected, thanks to our policy shift to partnerships as effective project implementation and service delivery frameworks. There is no better way of driving this vital point home than this event. Through a close and strong partnership with Global Fund, Kenya entered into effective engagement with other governments, civil society, the private sector, and affected communities, which enabled us to register remarkable progress in improving public health. As has been mentioned by the representative, apart from these 20,000 cylinders, we have a whole 5 billion shilling other projects that will be in the health sector that will support our push to every citizen to have access to health. In particular, the partnership we have fostered with Global Fund has contributed hugely to our country's tremendous progress in combating 3 of the most devastating diseases, HIV and AIDS, TB, and a major drop in national malaria prevalence from 8% in 2015 to 6% in 2020. Currently, the Global Fund grants to Kenya for 2021-2024 amounts to $441 million that is almost, by all counts, billions of shillings, and is implemented by various partners, including the National Treasury, AMREF Health Africa, Kenya Red Cross, and other agencies. The National Treasury implements its portion through the Ministry of Health, NASCOP, Malaria and TB programs, National Syndemic Disease Control Council, Health Systems Department, county governments, and of course, KEMSA. On its part, AMREF Health Africa implements the grant through 46 community organizations, while the Red Cross does so through 65 also community organizations. While it is undeniable that our partnerships have been remarkably successful, we must look forward towards an uncertain future, recognize and prepare for the challenges that certainly lie ahead. This realization is particularly imperative given our post-pandemic outlook. The devastating COVID-19 pandemic was an immense stress test that posed a serious challenge to our health systems and exposed its vulnerabilities. The Global Fund came to Kenya's aid and supported us in coping with the overwhelming systemic burden of the pandemic with significant financial support. This is appreciated, and let us clap for the Global Fund, my good friends. More significantly, the Global Fund stands with us even now in the pandemic recovery phase as we take robust measures to remedy the systemic weaknesses exposed by the pandemic. A major vulnerability highlighted by the COVID-19 pandemic is the medical oxygen supply chain. Kenya has suboptimal oxygen supply and poor infrastructure, as a result of which it is minimally available in public health facilities. the pandemic drastically intensified demand for oxygen, raising its cost by more than 75%. As a result, suffering Kenyans and their distressed families were driven into unprecedented despair. The Global Fund has been immensely supportive of our efforts to strengthen our national medical oxygen ecosystem, and I appreciate the fund's $41.7 million, about 5 billion Kenya shillings investment through AMREF Medical to support our oxygen supply and comprehensive infrastructure improvements, as was explained by Dr. Gitahi. This covers refill of compressed and cryogenic oxygen, acquisition of tanks and cylinders, installation of high-volume PSA oxygen generation plants, and the piping and installation of manifolds as well as oxygen outlets to health facilities. Today, we are here to witness the crowning moment of a highly successful partnership that has seen us through the hardest of times and strengthened us for the future. As we flag off 20,620 medical oxygen cylinders for delivery to our 47 counties, let us reflect deeply upon, but also appreciate with gratitude and celebrate an exemplary partnership that has remained committed and also transformative. We are highly encouraged by the success of our partnership and further emboldened in our mission to deliver to the Kenyan people a healthcare system worthy of their aspirations and consistent with our ambitions for socio-economic transformation. I assure all our partners, those who are present here and those who are not, of our unwavering commitment and tireless devotion to ensuring that your friendship, goodwill, and support yields much more and brings our people closer to the Kenya of our dreams. I also appreciate every actor and stakeholder that has taken part in the partnership that has implemented our public health agenda, whether they are in government, the private sector, civil society, philanthropy, or the communities involved. The implementing partners of our various interventions, and I want to state that we just concluded a small engagement with our county governments who are a critical component of the delivery of health, because health is a devolved function. And we have agreed that because health is a devolved function, we are going to begin from the bottom. In our universal health coverage plan, the unit that is critical and important is the unit at the bottom of the pyramid under a community health promoter. And we did agree in Naivasha that we are going to jointly identify and support the community health volunteers, community health workers. We have now agreed that they will be called community health promoters. And we are going to co-sponsor these community health promoters. We have agreed with the counties that we need to standardize the remuneration of these community health promoters, and we need also to standardize the kits. Standardize the kits that will be made available for them to use in the service they will be undertaking in every village in the Republic of Kenya. This program, hopefully, we should be able to launch when all is put together. I have committed that the national government is going to provide all the kits for all the 90,000 community health workers. And we are already preparing for the delivery of the kits. We have already agreed with the leaders of the counties here, the county governors, that to remove the constant challenge that we have had around the partnership between the national government, the county government, and our health workers. We are going to now inaugurate the Kenya Health Human Resource Advisory Council that is already provided for in law. And we have asked the county governments to provide the membership of this board so that we can use it to address some of the challenges that we have, whether it is challenges to do with the coordination between the national and county government, whether it's the challenges of personnel, especially personnel issues, teachers, not teachers, but doctors who are going on study leave, how we are going to work with them, how we are going to iron out some of the issues that have been raised by our health workers. And I think we now have a template on how we can resolve these issues in a way that gives everybody a chance around a table. We have also agreed with these good people on the subject of the primary care unit, because that will be the lowest unit that is going to account for the resources. And we have agreed that in every sub-county, we have identified 315 primary care units. And it is framed around every sub-county. We've asked the counties, under the leadership of our governors, to identify additional stakeholders to bolster that team, so that the team that exists at the moment of the sub-county health committees, that we increase it by bringing on board a representative of the health facilities that are run by faith-based institutions, health facilities, another representative of health facilities that are run by the private sector, a third person to represent the community, and the counties will provide a forum where the community can elect a person who is going to be in that committee, and also our development partners, maybe like Global Fund, maybe like AMREF, maybe the others who are players in different counties, that they do also provide a representative in that health committee, so that we can have a committee that can assist us to drive the universal health plan. We have agreed with these good people, the leaders of the counties, that this time round, we must get it right. And we cannot afford to have a misstep this time round. There's been 2 previous attempts on universal health coverage. This is the time we must get it right. I also want to appreciate Global Fund for the grants, also deserve very special appreciation. We expect uncompromising accountability, good measure of transparency, and proper utilization of the resources that have been put at our disposal. Finally, ladies and gentlemen, I would like to say a very special thanks to you, the Global Fund, for the commitment to improve healthcare in Kenya. A very special thanks to our governors for the contribution that you are making in this health space. And together, we have come far, and together, I am sure we will be going places. Receive our message of gratitude and best wishes from all of us, and we look forward to making further progress with Global Fund and with our friends in AMREF. Asanteni sana. God bless you. Thank you very much. Tutakutana huko mbele. Sindio?
Yes, I'll request that we just take 2 steps back to allow the track to be flagged off, as we now give His Excellency the opportunity and the chance to do the flagging off. There we go. That comes to the end.